Welcome back, everyone. Today we're taking a deep dive into diabetic retinopathy. We really wanted to get a clear picture of this condition. And to do that, we reached out to a true expert, Professor Dr. Suhail Sarwar, a top eye surgeon all the way in Lahore, Pakistan.
It's a pleasure to be here.
He's not only on the cutting edge of treatment for DR, but also diagnosis, using tools like OCT angio, and FFA to catch it early.
We can do some amazing things now with these technologies.
Really is remarkable. We're talking anti-VEGF injections, lasers, even vitrectomy for those really tough cases.
Right. We've got a lot of tools in the toolbox nowadays.
So let's unpack this a little bit. Can you give us a breakdown of what DR actually is in a way that anyone listening can grasp?
Think of it like this. That retina at the back of your eye, it's like the film in an old camera capturing the light to help you see.
Oh, that's a good analogy.
Yeah, and just like any film, it needs a good blood supply to work properly.
Makes sense.
It's almost like tiny plumbing in there. And DR happens when high blood sugar, usually from diabetes, starts to damage those delicate blood vessels.
Oh, so it's not just about diabetes itself, but how it affects the eyes specifically.
Exactly. When that plumbing gets messed up, the retina can't do its job right. And that's when your vision takes a hit.
And I'm guessing, this isn't a particularly rare condition, is it? We were looking at a study from PLOS1 focused on East Africa.
Yeah, that study really drives home just how widespread this is. It found that 25 to 29% of people with diabetes in East Africa also have DR.
Wow.
It's a huge number, and it really underscores that this is a global issue, especially with diabetes rates rising everywhere.
Absolutely. Those numbers are definitely eye-opening. So knowing that, what are some of the big red flags? Like what might make someone more at risk for developing DR? We know high blood sugar is a major factor, but anything else people should be watching out for?
Yeah, you hit the nail on the head. Prolonged high blood sugar is public enemy number one here. It's like constantly putting those delicate blood vessels under stress. And eventually, they just can't handle it. And multiple studies show the longer someone has diabetes, the greater the risk.
So it's really about how long those blood vessels are being exposed to that high blood sugar.
Exactly.
That's what the hemoglobin A1C measures, right?
You're right. That A1C gives us that snapshot of your average blood sugar over the past few months. So the higher the A1C, the more likely those blood vessels have been under duress.
Makes sense.
And the more likely you are to develop DR.
Okay.
And it's not just the duration of diabetes. Other things can really add fuel to the fire. High blood pressure, high cholesterol, even obesity.
Right.
It's often a combination of factors that really tip the scale.
So it's like a domino effect. One health issue can actually increase your risk for others.
Yeah, that's a good way to put it.
But what's really concerning is that unlike some conditions, you might not even know you have DR until it's already progressed.
Absolutely, and that's the real danger here. Early DR, it often doesn't have any noticeable symptoms.
Really? Yeah, you might not see any changes in your vision at first, but that damage, it's happening quietly in the background.
So no symptoms doesn't mean you're in the clear.
Not at all. And that's why it's so crucial for anyone with diabetes to get regular eye exams. We've got to catch this early before it starts stealing your sight.
Okay, so those regular checkups are non-negotiable. But when symptoms do show up, what should people be looking out for?
So as data progresses, you might start experiencing things like blurred vision or even seeing floaters.
Floaters?
Those little specks or strings that drift across your field of vision.
Oh, yeah.
And then difficulty seeing at night or even blank spots in your vision. Those are all red flags.
Mm-hmm.
But the thing is, by the time these symptoms show up, the condition has already taken hold.
So it's really about early intervention, and this is where Professor Sarwar and those high-tech diagnostic tools he uses come in.
Right.
You mentioned OCT angio, and FFA. Can you walk us through how those help him identify and assess DR? What are they actually showing him? Well, you can think of these tools like giving us this highly detailed map of the eye's blood vessels. So OCT, that creates cross-sectional images of the retina. So it lets us see any swelling or other damage in those layers.
Oh, wow.
Then OCT angio, that takes it a step further. It actually shows us the blood flow within those tiny vessels.
So you can see if things are moving properly.
It's like watching the traffic patterns on a map. We can pinpoint areas where there might be blockages or poor circulation.
So you're not just seeing the damage, but how the blood is or isn't flowing through the retina.
Exactly. And then there's FFA.
Right.
That uses a special dye that's injected into your arm.
Interesting.
That dye travels to the eye and highlights any leaky blood vessels.
So it's like adding a tracer to that map we were talking about.
Right, pinpointing exactly where things are going wrong.
So these tools are basically giving Professor Sarwar this 3D view of what's happening in the eye.
Yeah.
And that helps him determine how serious the DR is and what kind of treatment is needed.
Precisely. The type and stage of DR really dictate the course of action. Sometimes in early cases, just managing your blood sugar and those other risk factors, that might be enough.
Right.
But as things progress, Professor Sarwar might employ anti-VEGF injections.
And that is where we will pick things up in part 2 of this deep dive.
Yeah.
We'll explore those different treatment options for DR, looking at how these injections, lasers, even surgery can help protect your vision. So stay tuned. There's a lot more to uncover.
Picking up where we left off with those anti-VEGF injections, so these really target a key process in DR.
Okay.
They block the growth of abnormal blood vessels in the eye. And I say abnormal because they're not like your regular healthy blood vessels.
Right.
They tend to leak fluid and really contribute to swelling in the macula.
And the macula, that's that central part of the retina.
Exactly.
The one that gives us that sharp, focused vision we need for, like, reading or seeing faces.
Yeah, it's like the bullseye of the retina.
Right.
And when that macula swells up, it's called macular edema.
Macular edema.
Yeah, and it can really distort your central vision.
Oh, I bet.
Anti-VEGF injections are particularly helpful for that, as well as for proliferative DR,
Okay.
which is a more severe form where these abnormal vessels actually start growing on the surface of the retina.
So the injections are kind of stopping that problem at source,
Right.
preventing those leaky vessels from forming in the first place.
That's the idea.
So what about laser treatment? I know Professor Sarwar uses that too. How does that work?
So laser treatment is a little more about targeting the existing damage. We can use it to actually seal off leaking blood vessels or even destroy abnormal ones that are already there.
So it's kind of like a more direct approach?
Yeah, it's more like cauterizing a wound.
Oh, interesting. It's amazing what they can do with lasers these days.
Yeah, the technology has come a long way.
And then for those really advanced cases, there's vitrectomy. That sounds like a pretty serious procedure.
Yeah, vitrectomy is definitely reserved for the most complex situations. It involves surgically removing the vitreous, that gel-like substance that fills the eye.
The vitreous, yeah.
And this allows the surgeon to clear out any blood or scar tissue that might be clouding up the vision. It's a big step, but sometimes it's really necessary to restore as much sight as possible.
So it's like a last resort option, but it can make a big difference.
Yeah, it can be life-changing for some patients.
It really highlights the range of treatments available for DR.
Right. It's not one size fits all.
You know, from injections to lasers to surgery. It all depends on the severity.
Absolutely. We tailor the treatment to the individual.
And speaking of advancements, we can't forget about the role of artificial intelligence. You know, AI, it seems like it's making its way into every field these days.
Yeah, and eye care is no exception.
Right. We have a couple of studies here, one from Scientific Reports and another from International Journal of Retina and Vitreous, both from 2025,
Okay.
that touch on this.
Interesting.
So how is AI transforming how we approach DR?
Well, these algorithms, they can analyze retinal images and actually detect signs of DR,
Oh, wow.
often even earlier than human experts.
Really?
Yeah, it's pretty remarkable. And this is a real game changer, especially for people in remote areas or who face barriers to accessing specialists.
I can imagine.
You know, imagine being able to get screened for DR at your local clinic without needing to travel miles to see a specialist.
That would be huge, especially in areas where there might be a shortage of eye doctors.
Yeah, it could make early detection a reality for so many more people.
And that Scientific Reports study, it was focused on Korean patients.
Yeah.
And they found an interesting connection between high hemoglobin levels and a lower risk of DR.
You know, that just shows how much we still have to learn about the nuances of DR. Different populations might have unique risk factors or even protective elements. It's all part of the bigger picture.
Yeah, absolutely. And then the other study in the International Journal of Retina and Vitreous, that one really caught my eye.
Yeah.
They actually developed an AI-powered risk calculator for both DR and DME,
Interesting.
using data from routine health checkups. So instead of needing specialized imaging right away,
Yeah.
this calculator could flag people who are at higher risk, and then those individuals would need more in-depth testing.
Right. It's all about streamlining the process and making screening more accessible.
Exactly.
It could lead to earlier intervention for those who need it most.
It really seems like AI has the potential to improve patient care in a big way.
Yeah, and it's just the tip of the iceberg. You know, there's so much more to come.
Now, speaking of factors that can influence DR, there's another surprising connection that I came across: the role of sleep.
Sleep?
Yeah, a 2025 study in Nature Eye linked sleep to Dr. Tafidji. I was a bit surprised by that one.
Interesting.
What's the connection there? I always thought, getting enough sleep is just about feeling rested.
Well, it turns out good sleep is so much more than that. It's essential for overall health,
Right.
and that includes eye health. This study found that people who reported feeling sleepy during the day were more likely to develop DR.
And when you think about it, kind of makes sense, doesn't it?
Yeah, poor sleep can throw off your body's ability to regulate blood sugar.
And we know that high blood sugar is a major risk factor for DR.
Exactly. Plus, sleep deprivation can increase inflammation throughout the body, and that inflammation plays a role in DR development.
So getting enough sleep could be another way to protect your vision,
It's definitely a piece of the puzzle.
along with, managing your blood sugar and those other risk factors we discussed.
Absolutely, it's all connected.
So what else are researchers exploring in terms of DR prevention and treatment?
Mhm.
I'm always fascinated by what's on the horizon in the medical world.
Well, there are some really exciting avenues being explored. Personalized medicine is a big one.
Personalized medicine. Okay.
Yeah, tailoring treatments based on your individual genetic makeup and other unique factors. It's like creating a custom treatment plan just for you
Wow.
to maximize its effectiveness and minimize side effects.
So instead of just, patching up the leaks, so to speak,
Right.
these new therapies are going after the root cause of the problem.
Yeah, that's the goal.
That's incredible. And what about new drug therapies?
Oh, yeah. There's a lot of work being done there. Beyond just managing the symptoms, we're looking for ways to target the underlying causes of DR.
I see. So it's not just about treating the damage, but preventing it altogether.
Exactly. It's about getting ahead of the curve.
And then there's research into dietary interventions. I read a 2024 study in Frontiers in Nutrition that found a possible link between vitamin B6 levels and DR.
That's really interesting.
It's still early, but it suggests that what we eat could play a role in managing DR.
Absolutely. Diet and nutrition always have a huge impact on our health.
Wow, we've covered so much ground in this deep dive. But I feel like we're just scratching the surface. There's so much happening in the world of DR research and treatment. It's pretty amazing.
It really is an exciting time to be in this field. There are so many breakthroughs happening all the time.
And before we wrap up part 2, I want to remind you, our listener, that this is just a starting point. We encourage you to dig deeper, ask questions, and stay informed about your health, especially if you have diabetes.
Knowledge is power.
So let's take a minute to recap what we've learned about diabetic retinopathy. We've covered a lot of ground.
I think the main takeaway here is that DR is serious, no doubt about it. But it's not a hopeless situation. With early detection and proper management, we can make a real difference in preserving your vision.
Absolutely. And we've talked about how crucial those regular eye exams are for anyone with diabetes, even if you're not experiencing any symptoms.
Yeah, prevention is key here. And thanks to the work of folks like Professor Sarwar and those advanced diagnostic tools, we can catch DR early, when treatment is going to be the most effective.
We've talked about those anti-VEGF injections, laser therapy, and even those more complex procedures like vitrectomy.
We have a lot of options depending on the individual case.
And who would have thought that AI could play such a big role in diagnosing and managing DR? It's remarkable how technology is changing healthcare.
It really is. But, technology is just part of the equation. And it leads to a question that I've been thinking about. If early detection is so important, how do we make sure everyone has access to the care they need, especially those in underserved communities where the resources might be limited?
That's a really important point. It's a question of equity and access.
Absolutely. And, it's not just about having the latest technology. It's about making sure that technology is available and accessible to everyone. We need that community outreach, education, and we need to break down those barriers to care.
I wonder if leveraging telehealth platforms or maybe even those mobile screening units could help bridge that gap. And of course, public awareness campaigns are so important.
To really educate people about DR, about the importance of those regular eye exams, we need to empower folks with knowledge so they can advocate for their own health and seek out the care they deserve.
It really takes a collective effort. Healthcare providers, policymakers, the community as a whole. Well, you've certainly given us a lot to think about. Thank you for joining us for this deep dive into diabetic retinopathy. We hope you found it informative, empowering, and maybe even a little bit inspiring.
My pleasure. Knowledge is power, especially when it comes to your health. Stay curious, stay informed, and keep those eyes healthy.
And to our listener, thank you for tuning in and diving in with us. Keep learning, keep asking those questions. There's a wealth of information out there, so take charge of your health and never underestimate the power of those regular eye exams. Thanks again for joining us.